election season and pandemic difficulties have left a lot of us feeling anxious, and that means keeping mental health top of mind for you and your family is extremely important. KZI 9 News anchor Chris Lewinberg has tonight's Healthy Living, sponsored by Oregon Medical Group.
It's been over 7 months since stay-at-home orders were issued here in Oregon, and while it shaped the state's coronavirus response, precautions can also have an impact on people's mental health, young and old alike. Oregon Medical Group pediatrician Dr. Laura Sanderson has been keeping her eye on the rates of anxiety and depression among teens and tweens over the past years, rising alongside social media use.
Since the pandemic started, it has just skyrocketed.
Social distancing, other precautions, financial stress, and more are impacting people of all ages.
Kids are sponges and they pick up on the stress around them. They see that their parents are stressed. They see some of the news.
Sanderson says when anxiety and depression come to the surface, interference with sleep, appetite, and thoughts of self-harm should be signs that you or your child should see a professional as soon as possible.
But even if it's milder anxiety and depression, it can be just incredibly helpful just to meet with your primary care doctor, your pediatrician, and talk about it. Sometimes just acknowledging it is very therapeutic.
If you're hoping to address you or your child's mental health, Sanderson says your primary care doctor is a good place to start. They can help guide you and refer you to a specialist if needed. But day-to-day, getting some fresh air and taking the time to have face-to-face interactions with your household pod can promote good mental health. Sanderson also says that for youth, limiting screen time outside of class, as well as social media usage, is a good idea too. In the studio, Chris Lewinberg, KZI 9 News.